Good morning, everyone. This is Deb Wilkinson from URL Insurance Group. I am the Vice President of the Health Plan Options Division here at URL. And what that means is I oversee the individual and group health portions of the business for URL and our broker partners. This webinar is being pre-recorded due to a commitment that I do have on Thursday the 2nd. But with everything happening so quickly and rapid changes as we've discussed throughout the weeks, I think it was important to at least record a message to keep you up to date as much as possible with this rapidly changing market. So first things first, the new administration, the President had a listening session with the health insurance carriers this week. They were encouraged by the meeting. There's not a lot of details that came out of it, but they were encouraged by the meeting, and really, basically, they decided that between the administration and the carriers, they were going to make sure that any replacement or repeal would be done right to protect the citizens of the United States. So I think that is encouraging, and of course, the President was also encouraged by reports. Of course, last night the President spoke to Congress. It's reported that he devoted about 5 minutes to the repeal and replace. The focus was on giving states more latitude for Medicaid and Medicare changes. So it looks like, according to the speech last night, that some of the provisions would be putting more discretion on the states to kind of take these federal dollars and create Medicaid and Medicare programs that meet the needs of the state versus a national program. Of course, everything is still up in the air, so we'll keep watching for anything that is noteworthy. There was a report that the leaked GOP replacement plan for the ACA is no longer valid. So whatever plans you have out there, read them with a grain of salt, as I do, because they are coming in rapid fire, but the leaked GOP replacement plan, no longer valid. Earlier this week, we did hear from CMS that they were going to possibly extend the grandmothering provisions for individuals and groups. Currently, it stands at 12/31 of 17 that all the non-ACA plans would have to go away. The CMS did allow for the extension up until 12/31 of 2018 for any plan that starts after October 1st. I'm sorry, before October 1st of 18, and then extending again through 12/31 of 18. We did just receive news that the Pennsylvania Insurance Department is allowing the carriers to continue with grandmothering provisions. So for all of us that have grandmothered plans or still have clients with grandmothered plans, I'd consider that a win for us. So that's good news. Next week, the President is to meet with Representative Cummins to talk about the RX import system. They drafted a bill, and Representative Cummings is going to ask the President for his backing on that bill to allow imports from Canada or other countries to help drive down the prescription costs. And I think we all have been in this industry long enough to know that something needs to be done on the prescription costs, and hopefully this is something that will be embraced. I believe it will be. I know when Senator McCain was running, this was part of what he wanted to have done. So it's definitely a GOP-driven incentive, but getting it done may be more difficult with all the big pharma lobbyists. So we'll see how that works, but definitely that would be a win as well. On to the next subject. Anthem will begin mailing letters out this month to notify parents, guardians, and adult victims who were minors at the time of the breach about the Anthem Minor Credit Protection Program. They don't say how many letters are going out, but if your client is going to get or is affected by this, they will get a letter. There is a program that they can opt in for 1 year after the date of the letter from Anthem. And if they have questions on the program, which is being supplied through All Clear ID, you can call for questions or check on anthemfax.com for additional information about the data breach and that identity protection coverage. Just a note, don't forget about our complimentary offerings for group health. We do offer the complimentary summary of plan documents, the POP creations, benefit notices, which is a new offering, Cobra for groups of 20 plus, the federal Cobra. We provide that complimentary to your group. And of course the HR 360 subscription. They can, your groups can have access to this system, and again, you can promote these programs as your value adds. Last week I shared with you a Think HR article which talked about how to approach groups and talk about some of the pain points they experience during renewals. This goes right into, feeds right into that, you know, getting in contact with these groups mid-year to build those relationships for the 12/1 and 1/1 renewals. And these value adds you can promote as your value adds. You can go into an employer and ask if their current broker is providing these benefits, among others, such as our Benefits Connect system, etc. So again, approach these groups, present these programs as your value adds, and hopefully pick up some new business that way. Last on the agenda is just the announcement that this Friday, March 3rd, from 8 to 12 at the Sheraton on Lindle Road, which is right by the Turnpike and Eisenhower Boulevard. They will have a 2 CE credit course. It's running from 8 to 8:45 is registration and breakfast. 9 to 10 is a 1-hour CE done by Steve Jackson from Prime Pay, talking about the new regulations and expansion of the HRAs. And what that means to your group and to your employers that are offering individual coverage. There's also another hour CE from John Greene, who is NAHU Vice President of Congressional Affairs, about the new world of healthcare. I think this is certainly timely, and John's going to have the most up-to-date information about some of these plans and what his take is on how long this ACA will take to unravel. I'm sure he'll have a lot of information to share. And then the last half hour, no CEs, but the last half hour will be conducted by Vince Phillips, our PPAHU lobbyist. He'll do a Pennsylvania State of the Union and legislative update. So again, it's a timely seminar, a lot of big hitters here with John Greene and Steve Jackson coming in. So it is something that I think if you have the time and the interest that you may want to register. This will be in my newsletter on Thursday, so hopefully you'll take some time to look at the agenda and register. That brings us up to date with this week's webinar. I appreciate all of you listening in. We will be back live on Thursday, March 9th at 9:30 with a lot more information to share. I appreciate all of you listening in and your business and partnership. And again, if you have questions about any of our offerings, I encourage you to reach out to me and learn more about what we can do, how we can work together to build your block of business. Thanks again and enjoy your day. Bye-bye.